Krista, how long have you been with the blood bank?
So I have been with Community Blood Center for 11 and a half years.
Okay, 11 and a half.
Yes.
So you just took over in a management position, correct?
Yes.
Okay.
Yeah. Back in July of the year before.
Okay.
Yes.
So what does the Community Blood Center do? I guess 'cause for somebody who has no idea.
Yeah, so we collect blood products that go to the hospital. So anytime if you're in a car accident, you have a surgery, you need a blood transfusion, that's what we do. We make sure that we have blood on the shelf for anyone that needs it.
Okay.
And we specifically supply the local area hospitals.
Okay. Now when you say local, how far of a radius?
Anywhere in the Northwest, was it Missouri and Kansas?
Okay.
So here and parts of Kansas. So anywhere here in Missouri, we serve over 60 hospitals in over 70 counties in northwestern Kansas and northwestern Missouri.
Okay. Okay. So is giving blood the same as giving plasma?
No. So it's different. When you get paid for something, they cannot use that for a transfusion.
Okay.
So they will make it into certain medications and a lot of medical research. So it's owned by pharmaceuticals. A transfusible product, we cannot pay anybody for. It's an FDA regulation. Also, it just makes sure that what you're receiving is safe. It makes it safer because that means that people are just coming in for their own goodwill, donating a product for you.
Okay. So, all right, somebody's never given blood. What's the first steps? What does that whole process look like?
It's super easy. Just come on in with a picture ID. We love when you have a picture ID. We need a picture ID for you. But just come in with a picture ID. Make sure that you're well hydrated, rested, and you've eaten well for the day. That always makes the donation process super easy on you. If you donate with a full stomach, that you drank, and that you've had a good night of rest, like that's gonna set you up for like the best time.
And do you guys still provide snacks after you?
Oh yes,
okay.
yes.
Okay.
We have really upped our snacking game there. We provide a lot of different types of drinks, pop, juice. There's even Powerade now. We have different types of snacks. Of course, we have the Nutter Butters and Oreos, just like normal. Like, we have Cheez-Its now, so, yeah.
So, I feel like in the past, I've heard, the blood bank talking about there being a great need in the community.
Yeah.
Do you feel like that certain points in the year there's a greater need than others? Like, where are you at right now as far as demand?
Yeah. So I think right now we've always seen different trends through the whole year. Just being there for so long, I've definitely seen the trend. But what the main trend of it is now is that we just keep getting less and less people to donate. The older population is not able to donate, and they were our biggest donators, the baby boomers. So we just need to kind of pick up and educate people and just make them realize like there's still a really big need for blood, and we really need blood. And I think it's the consistency, and if people, even if you just come in once or twice a year to donate, if we've got maybe 100 more people, 200 more people just to come in once or twice a year, that would help us not be put in that emergency need or low blood supply need like we kind of tend to do off and on through the year.
Okay.
So, yeah, it just takes maybe just coming in, even if once, twice, 3, 4 times a year to donate blood would be so helpful.
And how long does the process actually take once you're there?
So, registration, it only takes about 5 to 6 minutes. You do like a little questionnaire. There's a mini physical that takes about, maybe another 10, 15, 20 minutes. Just depends on how long it takes you to answer all the questions. So then you do like a little mini physical. We'll take your blood pressure, your pulse, we'll check your temperature, we'll check your hemoglobin, your iron level, just to make sure that you're good to donate. And then once you pass all that, the actual blood donation, it can take just about, I would say like 6 to 10 minutes, as long as we have everything set up. And it takes less than 20 minutes to donate. And then we want you to sit for about 10 to 15 minutes afterwards, just to make sure that you are feeling well before you leave.
So maybe 30 minutes in all?
30 to 40 minutes, yep.
Okay. So
Yep.
simple.
Yep.
30 minutes.
Yep.
give blood.
So that's called a whole blood donation.
Okay.
If you want to do the extra mile, there's also called double reds, and there's something even better. It's called platelet donations.
Okay.
Platelet donations is our longest procedure. It takes about 2 hours, but it's also our shortest lived product on the shelf. It only has a shelf life of 7 days, and 2 to 3 of those days are used for testing and shipping and stuff. So actually, there's only 5 days that platelets are good for outside of the body once we harvest them. So we have to consistently have platelet donors. So
I didn't know that was even an option.
It is, yeah. That's the only way we get platelets. And platelets are your clotters. So when you get a cut, that's what stops you from bleeding.
Okay.
So those are the platelets. A lot of cancer patients have to have platelets because of the chemo that they go through and stuff. They're going to require to have platelets. Not first time, but mothers just giving birth, a lot of times have to have platelets. There's a lot of times where, for some reason, something with that, they have to have platelet transfusions, and that will really help moms like stop clotting and bleeding and stop bleeding the clot. There we go.
Okay. So we are going to team up with Community Blood Center.
Yeah.
October 15th through the 31st. So anybody who goes in and gives blood is going to get a coupon for a buy one, get one scoop here at Baskin-Robbins. So go, get involved, help out.
Yes.
People need it.
Yeah, and we just come in. We will always answer any questions. There's a lot less restrictions than a lot of people think, and it's really easy. And we'll answer any questions. We'll walk you through it. It's a really safe place. It's a really comfortable place. We've got birds. We talk a lot about birds.
And where are you located?
Off of Frederick,
Okay.
3122 Frederick.
Okay.
Across from the American Angus Society.
Okay.
So,
right.
and the Habitat for Humanity, just right across the street from there.
Okay. Well, Kristen, thank you.
Thank you so much.
Appreciate it.